Hi, my name's Layla and I am one of the midwives up at Cramlington Hospital. What we're going to do in this video is talk a little bit about first stage of labour. So we've had the latent phase where there's changes to your cervix. We class first stage of labour as you are more than 4 centimetres. So it's a guesstimate, but A-OK, around about 4 centimetres, okay? From that point, you are having regular contractions, your cervix is 4 centimetres, and we're hoping to get you through this labour to being fully dilated. This is what we call first stage. At this point, we're looking at support for you. So your birth partner really important and your midwife who's there with you. And this is regardless of whether you're at home or whether you are here with us in hospital, whether it's one of our midwifery-led units or here at Cramlington. What we're looking at is those nice regular contractions, and again you might be looking at hypnobirthing, you might be looking at how we cope with this, about plenty of mobilisation, about your options of what you've thought about for pain relief. So this is really good to have a birth plan in mind. And again, it is a plan, okay, so sometimes you can deviate from that because we always say baby decides when and how they're going to be born, okay? So sometimes it can deviate, but it does give us a good idea of what you want to do and choices within this certain stage of your labour. So you have these contractions or surges, which is basically your uterus is a big muscle, okay? So it starts right at the top and you contract through. So it basically works its way down, right down to the cervix, which is low down in your pelvis, and it starts to dilate that open to get you to the point of being fully dilated for this baby being born. Really important stage, as I say, where we're looking at keeping you mobile, seeing how you change throughout that. And it can be hard work, okay? Aptly named labour, it is hard work, all right? But with the right support and the right positive attitude, it's a great way to know that you're going to birth your baby. What we're looking at is changes within that cervix. An idea is usually 0.5 centimetre to 1 centimetre an hour is how your cervix will dilate. So we know that we're progressing throughout this labour stage. Again, we can look at different stages. So externally, we might see how your body is changing and how you might be progressing through this. So your midwife might ask if she can pop her hand on the top of your uterus, because we can feel how long your contractions are lasting. We can feel the strength of them, how frequent they're coming. And also, as we discussed earlier on, in a previous video, we're talking about how we monitor the baby's heartbeat. So is your baby coping with this? How are you managing? What kind of support that you would like with that? Again, we've got information about pain relief choices. We will look at internal examination. So this is a vaginal examination. Please don't think that it's a given, because some people know what their body's doing and would prefer not to have a vaginal examination. They might think, I know that I'm in labour, I know that I'm progressing well. Some, however, and it's routine, it's normal that people will have a vaginal examination, because we can think, right, yes, you were 4 centimetres when you came in, and 4 hours later you're 6 centimetres, fantastic, or you're 7, you're 8 centimetres, brilliant. It gives us an idea how it's progressing. Within this first stage, you have your transitional period you might have heard of. So again, it tends to be once you're getting up to being fully dilated, women may have been coping beautifully and they may be really calm, but you get to a point where you feel anxious, you feel like you can't do it, you start to feel frightened, and this is all normal. It's reassuring. So again, as a birth partner or as a midwife, we want to be there and saying it's okay to feel like this. I'm sure you're progressing through your labour. We're going to support you through this. Be confident in what your body's doing, and we're going to get you to the point where you're ready to birth your baby.